Hi, I'm Dr. Jamie Newer.
My name is Dr. Vitaly Moseson.
Hi, I'm Dr. Thomas Ferrigno. I'm the owner of Bay Area Disc Centers.
Yeah, in the beginning of my career, we were mainly focused on taking care of athletes, and we've seen our share of all sorts of athletic injuries. But as I progressed through practice, I've noticed that the toughest injuries to get rid of were the disc-related injuries.
Several years as a chiropractor, I actually developed a severe disc injury. And when I developed that severe disc injury, I'd lost my motor strength in my leg. I was pretty much disabled for a while. And I started getting spinal decompression treatment as a patient. And it made such a drastic difference in my life that I decided to really change the whole focus of my practice.
Yeah, so we developed a non-surgical solution that is based around spinal decompression called disc restoration therapy. We've noticed that when we added certain therapies around spinal decompression, the outcome has become a lot more stable, and it was really built around non-surgical spinal decompression. We found that as opposed to doing spinal decompression alone, when you add these other therapies that make up the disc restoration therapy method, the outcome ends up being much more successful, much more effective, and much more longer lasting.
I've had a lot of patients in my career with back pain as a sports medicine doctor in primary care. It's unfortunately a very common problem. I found that this method has been very helpful for my patients. Throughout the protocol, and especially after the protocol is completed, people have really improved the amount of pain and disability that they've had.
Yeah, the primary conditions we see, it can range from severe back pain to pain down your leg. Sciatica is a very common one that we see that is actually caused by a disc. And one of the most common complaints we hear in our office is that somebody can't walk for longer than 15 minutes or stand longer than 15 minutes. And that is related to the disc directly.
Let's learn a little bit about how a disc normally stays healthy. So when you're born, that disc is about 85% fluid and nutrients. And really the more fluid and nutrients, the stronger and healthier the disc is. Gives us its height, gives us that cushion that we need for compression, allows more room for that nerve to breathe. And a healthy disc has what we call a pumping mechanism in the disc. And that pumping mechanism is as we bend, twist, and move, well, that disc pumps. It pumps fluid and nutrients in, pumps fluid and waste products or inflammation out. And as long as you have a good healthy pumping mechanism and good motion in your spine, you will have healthy discs all your life. But with traumas, auto accidents, sports injuries, just repetitive stresses, lifting, bending, bad posture, aging, genetics, we start losing fluid and nutrients out of that disc. That disc starts to dry up like a dried up sponge. And when it dries up, it thins, it tears, and then that jelly material starts to squeak through those tears, starts to bulge, and put pressure on the exiting spinal nerve. And this model really shows how when that disc bulges, it bulges out, it hits that nerve, and that's when you start getting pain. So there's two key problems. The disc dries up and thins, and the disc bulges and herniates. So when it comes to treating, well, we really want to do something that brings fluid and nutrients back into the disc and retracts the disc. So that should be our primary goals when we look at treatment for a disc injury. So really the main keys to spinal decompression in DRX 9000 is really to help patients who are suffering from degenerative disc disease, disc herniation, sciatica. And spinal decompression is not a chiropractic thing. This is really devised by medical doctors. Dr. Alan Dyer, who invented decompression, and Dr. Norman Shealy, Harvard neurosurgeon, who did most of the protocols and research. And what these doctors wanted to do was find a way to treat degenerative disc disease and disc herniation in a non-surgical manner, because they knew the outcomes of surgery have been very poor and there's a lot of risk. So with the DRX 9000, there's some really key advantages to this table. One, we could specifically target one disc at a time, and we do that really based on angle of pull. You're laying on your back, pillow underneath your legs. It is a painless procedure. Most patients fall asleep. And we're able to pull at a specific angle for a specific disc. The higher the angle, the higher up the back we go. So one, it's very specific. Two, the reason it's so comfortable and why most people fall asleep is it's sensing your muscle tissues several thousand times per second. It pulls in a sinusoidal waveform to kind of trick your muscles. So it kind of pulls and relaxes, and it ramps up that pull. It's not a big abrupt pull, so it's very comfortable. Your muscles get very relaxed. We're very specific in our pull, so we could get a great negative pressure and a great vacuum effect to suck in the fluid and nutrients and also suck in disc material. And really, those are two of the key advantages of the DRX 9000.
Surgery is great if you absolutely need it, if it's minimally invasive. Surgery comes with its risks. Surgery is less than 50% effective, we found in our office. So you always want to take care of something conservatively. You always want to try a non-surgical approach before you undergo more of an invasive procedure, because those carry their risks.